Good evening students. Today I am going to discuss about the care of a normal newborn. As you all know, normal newborn, the age of the normal newborn is from 0 to 28 days. That means we have to give special care to the newborn at the time of the birth, since the immune power as well as the care of the baby is much important to prevent complications like hypothermia or any other infections. So we have to provide the initial care to the baby to maintain respiration and initiate lung expansion, then supporting thermoregulation, then creates prophylaxis to prevent the eye infection with neomycin and vitamin K, then cord cutting and dressing and identifying the infant, then taking anthropometric measurements and giving the first bath. So, the personals and equipments to be present at the delivery is much important that a well-equipped team of health persons which is specialized in neonatology should be present at the delivery room. No other personals as a deputing members in the team of health workers is not allowed to stay in the labor room. The personals that is specialized in neonatology must be present at the labor room to provide resuscitation to the baby at the time of birth. The next is the checklist. That means for resuscitation preparedness, we have to provide warmth to the child. That is, we have to keep a warmer at the labor room, then thermoregulation. And then we have to clear the airway of the baby using 10 to 12 French suction catheter attached to a wall suction, and the pressure of the suction catheter should be 80 to 100 mm of Hg. Then there must be a mechonim aspirator. Then for clearing airway, there is for ventilation we have to check for the availability and functioning of the self-inflating bags. Then check for the availability of all sizes of mask, that is 0, 0, 0 and 1. Then 8 French feeding tubes and 20 ml syringe. Then for oxygen delivery, oxygen tubing or TP is resuscitator that can deliver the free flow of oxygen. Then pulse oximeter. Then option for providing varying concentration of oxygen. Then for intubation, laryngoscope with plates of size 0 and 1. Then endotracheal tube sizes 2.5, 3, 3.5 and 4. For medication, we have to provide access to 1:10,000 unit of epinephrine and normal saline, and supplies for administering medications and placing emergency umbilical venous catheter. Then neonatal case record sheet for documentation, and for transportation there should be an incubator. Then time of birth. Time of birth is much important that the attending health professional or the nurse should note the time, and it should be announced louder for the awareness of the other persons who are attending the case as well as for documentation. Then standard precaution and asepsis at birth, we have to keep the universal precautions. The healthcare professionals that are taking care of the baby and the mother should take all the universal precautions at the time of birth, because all the fluid products from the baby as well as the mother should be treated as potentially infectious. They should warn all the face shield, eyewear, goggles, then mask and all, gown and all. And it is important to prevent the infection at the time of birth by observing 5C. 5C is much important to prevent the infection, that is clean hand, clean surface, clean cord, clean thread, and do not apply anything on the cord. These are the 5C. Clean hands, clean surface, clean cord, clean thread. Do not apply anything to the cord. First is clean hand. Appropriate hand hygiene and wearing sterile gloves is much important while attending the delivery. Then clean surface. Use clean and sterile towel to dry and cover the baby. Then clean cord. The umbilical cord should be cut with a clean and sterile blade and scissors. Then clean thread. The cord should be clamped with a clean and sterile clamp or tie. Then do not apply anything to the cord. Then prevention and management of hypothermia. So hypothermia is one of the important complications immediately after birth, since the child is having less brown fat, and also the hypothalamus is not much matured at the time of birth to keep the body temperature. So immediately after birth, the newborn is at maximum risk of hypothermia. The early hypothermia is it will cause much drastic changes in the health of the infant in the later period of life. So special care should be taken to prevent and manage hypothermia. It should be ensured that the delivery room should be not less than 25 degrees Celsius of temperature and free from the flow of air. And the pediatrician should receive the baby directly without a mediator, or there should not be a middle person in between the gynecologist and the pediatrician. The pediatrician should directly receive the baby in a preheated towel, and also there should not be any contact with the wet linen, to any of the wet linen at the time of delivery to the infant's body. And the infant may be placed on the mother's abdomen immediately after birth to keep skin to skin contact, as well as to provide psychological support to the mother, which eventually causes the reduction in the pain of the mother as well as bleeding of the mother, because of the psychological change that her child is psychological to give psychological support to the child. And there is many studies have found out that there will be change in the bleeding as well as pain. The pain will be reduced because of the psychological feel that her child is safe. Then the baby should be observed for transition period, and the baby should be transported from the labor room after cord clamping. So next is delayed clamping for of umbilical cord. Then the umbilical cord clamping must be delayed for nearly 2 minutes in order to allow transfer of additional amount of blood from the placenta to the infant. This delayed cord clamping is much important in the term babies to improve hematological status, iron status, and clinical anemia. The next is cleaning the baby. So the baby should be dried and cleaned at birth with a clean and sterile cloth. The cleaning should be gentle and should only wipe the blood and meconium. The vigorous application of the towel is not appreciated, because it will cause the excessive removal of the vernix gaseosa, which is a white cheesy substance that protects the skin from external infections as well as to prevent hypothermia. So we no need to wipe the vernix gaseosa in excess. The next is clamping the cord. The cord should be clamped at 2 to 3 cm away from the abdomen using a sterile clamp which is commercially available, a clean and autoclaved thread, or a sterile rubber band. These all can use to clean to clamp the cord, and the stump of the cord should be away from the genitals to avoid contamination. The next is care of the eye. At the time of the birth, the eyes should be cleaned with separate swabs, and the sterile swabs or the normal saline may be used for this purpose. And we had to swipe with clean swab on each eye from the inner canthus to the outer canthus. In some hospitals, they will provide CREED prophylaxis, which means it is antibiotic prophylaxis for the prevention of ophthalmia neonatum, which is one of the eye infections that can be seen at the time of delivery. Then placement of identity band. It is much important because the birthing place may be a place with high birth rate, or there are many other deliveries that have happened at the same time of the delivery of the particular mother. So to avoid confusion or the loss of the there are chances of loss of the newborn at that time, or at any emergency. This identity band is much important. So according to the hospital protocol, the emergency band should be provided for both the mother and the infant. The emergency band should consist of name of the mother, hospital registration number, gender, and birth weight of the baby. And in some hospitals, they may take the footprint of the baby also, which is a part of identification. The next is recording Apgar score. So Apgar score, we are checking the Apgar score in the first and fifth minute of the labor, and this Apgar score will help to decide the normal health status of the child. And I will explain the Apgar score in the neonatal examination and assessment in the next class. The next is weight record of the baby. The baby should be weighed after stabilization and temperature and documented to be normal. A sterile preheated sheet should be placed on 5 to 10 gram sensitivity weighing machine. Then zeroing of the machine should be performed. The baby is gently placed on the weighing machine and weight is recorded. Okay, then normally the weight of the baby should be 2.5 to 3.5 kg according to the Indian protocol. Then initiation of breastfeeding. The breastfeeding should be initiated at the earliest. Uh, the health the healthcare provider should actively assist the mother to put the baby on breast irrespective of the mode of delivery. Breastfeeding counseling alone without any active proactive support. We have to give breastfeeding counseling to the mother, especially if the mother is a primipara mother, and time of initiation of breastfeeding must be documented. It is much important. Then vitamin K administration. Vitamin K should be administered. It is also a part of CREAT prophylaxis. Along with the CREAT prophylaxis, vitamin K administration is also added. It should be administered to all the babies, 0.5 mg for babies less than 1000 gram and 1 mg for babies more than 1000 gram should be provided. It is preferably to administer the vitamin K1. However, it is not available. If the vitamin K1 is not available, we can provide vitamin K3. It should be administered as an IM injection using the 26 gauge needle and 1 ml syringe on the anterolateral aspect of the thigh. Okay, we are administering on the anterolateral aspect of the thigh, and it is an IM injection with the help of a 26 gauge 1 ml syringe. 26 gauge needle and 1 ml syringe. Then first examination, the baby should be thoroughly examined by attending person from head to toe, and findings should be recorded in neonatal record sheet. It is very important to examine midline structures for malformation, that is check for cleft lip, neck masses, check chest abnormality, omphalosis, meningocele, cloacal abnormalities, etc. Okay, then special attention should be given to identify and document the anal opening. There is no need for routine passage of catheter in the stomach, nostril and the rectum for detection of esophageal atresia, choanal atresia and anorectal malformation. So these all are the commonest malformations at the time of birth. Then the baby should be examined for presence of birth injuries in the cases with difficult extraction. Then the axillary temperature of the baby should be recorded. Then communication with the family. So before leaving the birthing place, the health person should communicate with the mother and the family members. The following facts should be clearly told to the family regarding the gender of the baby, birth weight, well-being of the baby, and one should ensure that the family members and the mother get to witness the gender and identity number of the baby. Then rooming in. Under no circumstance a normal newborn should be separated from the mother. In the initial few hours of life, the baby is very active, and the closeness of the baby to the mother will facilitate the early breastfeeding and bonding. The studies have shown that any separation during these initial hours may have a significant adverse impact on various outcomes, including successful breastfeeding in later stage of life. Thank you.